Hello students, welcome back to Pharmaceutics 1. Suppositories we are going to discuss today. The contents of these suppositories are as follows. Excuse me. We will see the definition, types, advantages, disadvantages. What are the different types of bases, methods of preparation, displacement value, and how do we calculate the amount of the drug that displaces one part of the base. We are going to discuss in displacement values, followed by evaluation of suppositories. Now first let us see what are suppositories. Suppositories are defined as conical or ovoid solid preparations containing drug for insertion into the rectum where the suppository melt, dissolve, disperse to exert to give a local action or a systematic effect. So what are suppositories? These are defined as conical or ovoid shaped solid preparations containing the drug for inserting into the rectum where the suppository will melt, dissolve, disperse and it will exert a local or less often a systematic effect. Now where we are going to incorporate the drug? The drug here generally it is incorporated into a suppository base. Now commonly we use the bases maybe from fat, wax, glycerogelatin jellies. Now suppositories, they may be of small size or long size. Now if a small suppository, if it is meant for ear cavity, then they are called as cones. If the small suppository is meant for inserting into the ear cavity, it is called as cones. But if it is a long, narrow form, which is used for nasal and urethral cavities, then they are called as bogies. B-O-U-G-I-E-S. Small suppository meant for ear called as cones. Long and narrow form suppositories meant for nasal cavity and urethral cavities are called as bogies. Now, what are the advantages of using these suppositories? So you can discuss the advantage along with the example also wherever it is asked. For example, the main advantage, it will exert a direct action on the rectum. Rectum is the place where there is a problem, like in the conditions like hemorrhoids, pruritus or ulcerative colitis. There is a direct action. So when you give the drug in the form of a suppository, it will show direct action on the rectum. Number 2, it promotes evacuation of bowels. That means you are suffering from constipation. So insert a suppository, it will relieve you from the problem of constipation. Examples, a pharmaceutical example, marketed example. For babies we use glycerol based and for adults we use biscuit oil. Remember this. Now the other advantage is these particular suppositories, they provide a systemic effect. Systemic effect means when the drug is given in the form of this suppository, that particular drug, it will be released even into the blood also and relieves the symptoms immediately. Example, as in the case of asthma, if a person is suffering from asthma or bronchitis, drugs like aminophylline are given in the form of suppository. Or for migraine, in the conditions like migraine, a drug like ergotamine is given in the form of a suppository. Now there is some analgesic problem or anti-inflammatory problem or pain is there, you can also give the drugs like indomethacin and phenylbutazone as a suppository. Now, the other advantage is they are very easy to administer to any group, age group of the patients. It can be given to children, it can be given to old people, it can be given to unconscious people. And these suppositories are more suitable when the drugs are getting irritated in the GIT. Say for example, when I take a drug, it is going to produce more irritation of the GIT. Or if the drug induces a vomiting, if you take a drug that will Automatically it will sometimes induce vomiting and you want to vomit that particular drug, then there is no action. In that cases, what is happening, we can give the drug in the form of a suppository. So what are the advantages? Number one, it will exert a direct action on the rectum, as in the conditions like hemorrhoids. Number two, it promotes evacuation of bowels. It will relieve you from constipation. Example of glycerol based for babies and biscodoil for adults. The drug also provides a systemic effect. They provide a systemic effect. When you are going to take the drug in the form of a suppository, it provides a systemic effect. As in the case like in asthma and bronchitis, drugs like aminophylline are given as suppositories. And in case of migraine, where you have a very severe headache, ergotamine is given. And when you have some pain, when you require some analgesic effect, antipyretic effect, anti-inflammatory effect, where you want to relieve the pain as well as a pain in the stomach or inflammation, you can use indomethacin and phenylbutazone. It is very easy to administer to all the age group. And it is also suitable for drugs which irritate the GIT, or the drugs which irritate or induce vomiting, or which gets destroyed in acidic pH of the stomach. Now, what are the disadvantages? The main disadvantage of this particular suppositories are irritant drugs. They cannot be administered as suppositories. That is the first disadvantage. The second disadvantage is it causes some embarrassment to the patient. The patient feel uncomfortable. Okay, generally we prefer oral route of administration, but when a patient is asked to use a suppository, he feels little bit embarrassed, or he may feel how to insert. He has some sort of inhibitions to use this particular medicament. And as you think, it is not easy to prepare, cannot be prepared readily, and required to be stored at very low temperatures, because if you are going to store at high temperatures, it may melt. And poor countries and poor patients cannot use it, as it is like costly dosage forms. Now, what are the different types of suppositories? We have different types of suppositories here. You can see rectal suppositories, meant for rectal purpose, vaginal, which are inserted in the vagina, nasal and bogies for nasal, urethra and urethral bogies for urethra, ear cones. These are the different types based on where it is applied, where it is placed: rectal, vaginal, nasal, urethral and ear cones. And new trends nowadays which are used is that these suppositories are also prepared in the form of a tablet. So therefore we call it as a tablet suppository, or 3 to 4 layers are used. Therefore these are called as layered suppositories. The suppository is placed in the capsule suppository, or the suppository is coated. It is called as coated suppository, and sometimes disposable molds. These are the different types of suppositories. Now, coming to a very important thing which you have to remember is marketed suppositories. So, what are the examples of marketed suppositories? The main examples of a marketed suppository includes Dulcolax. Dulcolax is a laxative suppository. It contains a drug called as bisacodyl. Bisacodyl. I repeat, marketed suppository. One example is Dulcolax, which is going to relieve you from constipation. So therefore it is called as Dulcolax laxative suppository. It is going to act as a stimulant laxative. It relieves constipation, and mainly each suppository contains 10 mg of the drug. What is the drug? Bisacodyl. Now the second suppository is for babies, as I said initially, glycerin suppository. Glycerin suppositories for babies. This is also used to relieve constipation in babies. So what are the two examples of marketed suppositories? Dulcolax and glycerin suppository for babies. Now, the last point what we will discuss here is properties of ideal suppository bases, how the base should be. So generally if it is asked in the exam, like you need to know, write a note on suppositories. Then first you need to start what is a suppository base. A suppository base is the one in which the medicament is placed, and the ideal properties. So you need to mention at least 3 to 4 ideal properties. The first one, the selected base, it should melt at body temperature. Number 2, it should keep its shape and good in appearance. Number 3, it should release the medicament immediately. It should not cause any delay. It should be non-toxic, non-irritant, stable and compatible, easily moldable, and stable when heated above melting point also. So this point you have to remember. These are the references. Thank you for watching.